Members, this is a telling point in the session. This bill is far, far worse than the one we sent to conference committee. Bad as it was, the bill we sent to conference committee would have caused about 835 Minnesotans who are elderly and disabled living in their community among us. They would have had their services jerked away from them and forced into a nursing home. This bill increases that number to 1,249 of our neighbors and fellow citizens who will have their services jerked away from them and forced into a nursing home. Another over 1,700 will lose their services and have lesser services offered to them. This bill will cause 140,000 people in Minnesota to lose their health care coverage. This bill will cost Minnesotans over 40,000 jobs. This, my fellow senators, is the jobs bill. We all know our hospitals are our major employers in all of our communities, and this is a terrible bill for our hospitals. And why? Why do we have this terrible bill here? As Representative Abler said to me yesterday in our hour-long preliminary discussion, well, you know, we've got this terrible target. You know, we have to cut a lot more than Governor Dayton did. And why is that, members? Why is that? Because someone making $150,000 to $250,000 in the state of Minnesota, because they are being asked to pay an average of about $4 a month more to help our community, to help the least among us, those who are sick, those who are poor, those who are old and poor, to be able to live with dignity. It's not too much to ask. $4 a month is not too much to ask. And why is that? Because most of our constituents are paying a higher percentage of our taxes today to take care of the least among us in our communities. It isn't about how hard somebody works for their money. We all work hard. Some of the hardest working people I know wait tables, empty bedpans, sweep and mop the halls. But we aren't asking those people to give more because they already give more than their fair share. $4 a month. $4 a month to help over 1,200 of our neighbors, friends, people who go to church with us, to be able to keep living in the community. It's not too much. Minnesota is better than this bill, my friends. When I think about the people that I see every day, the mailman who delivers my mail, the people who go to my church with me, the people who come to a town meeting in my district, the people who come to talk to me out in the halls of this Capitol. If I were to say to them, how about if we throw 140,000 of us off health insurance? How about if we tell 3,000 PCA recipients they're cut off, no more services? How about if we say to some of the sickest and most disabled people in our community, community services are off the table for you. You can go live in a nursing home for the rest of your life. How many of our friends, our family, our fellow churchgoers would say, well, that sounds like a good idea. I think we should go for that plan. Only the most insensitive, cruel, and inhumane person in Minnesota would say that's a good plan. And we know that over 70% of Minnesotans think our income tax system should be fairer. No, Madam Chair and Senator Han, Minnesota deserves better than this bill today. And so, Madam President, I move that the recommendations and conference committee report on Senate File 760 be rejected and that the bill be re-referred to the conference committee as formally constituted for further consideration.